Welcome to Straight Talk. I'm Eugene Chan. Are we spoiling our pets or just trying to love them right? My guest is the person in charge of training Hong Kong's only homegrown veterinary surgeons. Professor Vanessa Barrs is the Dean of CityU's Jockey Club College of Veterinary Medicine and Life Sciences, and the Bank of China Hong Kong Chair Professor of Veterinary Medicine, and she led the team that earned Hong Kong's first internationally accredited vet degree with Cornell University. Before joining CityU in 2019, she spent over 15 years at the University of Sydney's Veterinary Teaching Hospital. She is an internationally renowned infectious diseases researcher and has authored over 200 scientific papers. Professor Barrs, welcome to Straight Talk.
Thank you.
This is a show that we've been talked about for over a year now, and finally we have you on the show, and thank you very much for coming. I understand that you have trained and practiced over like 15 years in Australia, and you have seen sort of veterinary medicine in different cities with different cultures. So when you come to Hong Kong, or came to Hong Kong in 2019, I suspect one of the first things you might have noticed is that many people in Hong Kong, they treated their pets quite in a special way, like we have strollers pushing them around, birthday cakes, or even designer clothes. So let me ask you directly, as our title suggests, as a veterinary scientist, when you see a pet or say a dog in a pram or a cat wearing a sweater, do you think how lovely they look? Or do you think the animal may not be maybe better off with something else? What do you think?
I think that people in Hong Kong love their pets, and I think that they are no different to pet owners anywhere else in the world. I think that wearing clothes for animals is not something that animals really like. I'm not a big fan of.
Right.
Yeah.
But in general, I mean, you've been in different cities.
Yes.
Will you say that the pet owners in Hong Kong, are we spoiling our pets, or they're trying to give them the best? What do you think?
I don't think we're spoiling our pets.
Right.
I think in Hong Kong, just like anywhere else in the world, pet owners regard their pets as a member of the family. Mm-hmm. And that's the same whether you're a pet owner in Sydney, in London, in New York, the same the world over. Mm-hmm.
So I'm sure, as you just said, I mean, everywhere in the world, they want to, because they're part of their family, they want to do the best for them.
Correct.
Sometimes you might use the term overindulgence, or maybe better to say they're looking out for their well-being. So how do we actually draw the line? And have you ever seen cases that such overindulgence might actually harm the animal?
Look, I think that those sorts of cases are pretty rare. I think that, like I said, most people regard pets as members of their family. Where it can sometimes go wrong would be if an animal had a disease that was, incurable. Mm-hmm. And sometimes we need to put animal welfare first.
Right.
And if an animal is suffering, it's not right to treat that animal for the sake of the fact that you love it very much. We always have to remember that as pet owners, we are responsible for their welfare. We are the guardians of their welfare.
Right. I mean, when you mentioned that, I mean, I being a dental professional,
Yes.
we do have to think of the patient's benefit. But
Yes.
in case of a human being, you can actually ask them or you can gauge them. But then as for a pet, how can you tell?
Exactly. It's very difficult. And so pet owners need to look at whether their animal is eating, is it drinking, mm-hmm. is it showing normal behaviours, mm-hmm. does it want to go outside? And if it's not, then we have to think about what is that animal's quality of life.
Right.
Yeah.
I think, Professor Barrs, I'll call you Vanessa. I've known you for quite some time now through our work at City University.
Yes.
I must say that when I always see you, I'll talk about pets. But being the dean you're talking about, it's different, it's animals.
That's correct.
Maybe you can tell the viewers how you see sort of this vet school in terms of how they versus the pets that we talked about.
Thank you.
Good time to start there.
That's a great question. And the first thing I would say is that a veterinary school, a vet school is not a pet school. And veterinarians have many important functions in society. One of them is as guardians of veterinary healthcare, and not just the healthcare of pets, but also of our livestock production animals, cattle, sheep, goats, pigs, poultry, horses, also zoological animals and exotic animals. So that's one function. Another really important function is that veterinarians are the first line of defence against emerging zoonotic diseases, like rabies or avian influenza. They have a really important function in advising governments, advising government bodies like the World Health Organization, the Food and Agricultural Organization, the World Organization for Animal Health. They also have an important role in scientific discovery. You might have heard of Salmonella, the bacteria that was actually discovered by a veterinarian called Daniel Salmon, who was a graduate of Cornell University. They also have an important role in food safety, in detection of drug residues in animals before they're consumed for meat. And they have an important role in educating society about responsible pet ownership. So lots and lots of different functions.
Yeah, sure. I think we'll go back to the sort of vet training further on in the show. So when you're talking about, the reason why I started on this topic right at the beginning is letting the viewers know that pets, of course, are a very important part of our lives in Hong Kong, but don't underestimate the importance of the whole animal world sort of in relation to Hong Kong. When you talk about, say, pets, let's go into pets for a little while. What would be the most common problem that we see that can be easily overlooked by owners, that can be something very important, or even, as I said earlier, whether we could be carrying them too much, ending up they could be eating too much, or not having enough exercise, or all these inappropriate accessories, for example.
Sure.
So do you see any of that? Maybe it's a good place to share with the viewers.
I think pet obesity is a big problem as a result of feeding them too much and them not having enough exercise. That's one of the big problems that we see today. But there are lots of different diseases that pets can get. They get arthritis as they get older, just the same way that humans do. They get heart disease in the same way that we do. And it is very hard for pet owners to know when an animal is sick. So they often have quite an advanced disease compared to a human because they can't tell us that they feel sick.
Yes, unless you see they're sort of having a loss of appetite or loss of weight, then that could be a very long process. Yes,
it could be a very long process or sometimes a very sudden process.
I see.
Yeah.
And also another fact that about Hong Kong as compared to, say, Australia or you work in England is that our homes are sort of typically quite small, that despite our high population density and also the sort of the tininess of where we live, pet keeping culture has been quite established in Hong Kong. I'm sure we see that there are a lot of that in Hong Kong. So with a pet animal, predominantly cats and dogs, I know you're a sort of cat specialist, and that sort of grew markedly, especially during the pandemic. Do you think there are certain breeds that we should not be sort of having them at home, especially by having such a small place as compared to houses or farms in Australia or England?
Sure, that's a great question. And actually there's a number of different breeds that we need to be really careful about. And one of them is breeds called brachycephalic dogs. And by that I mean dogs that have really short noses. So things like pugs, for example, and Boston Terriers and bulldogs. They have problems breathing because they have been overbred and they have been bred to really accentuate these cute, short-nosed baby faces. In a city like Hong Kong, where it's really hot and humid, it's very common to see these animals coming into hospital with heat stroke, unable to breathe. They go into intensive care and sometimes, unfortunately, they pass away. So that's the first thing. And also, sometimes we see dogs like the big woolly Newfoundlands or Samoyeds, with a full hair coat in summer again. We need to think about, I think the decision for what type of pet you want to get really depends on an individual's circumstances, where they're living, and what kind of environment it is. Right. Are they able to take it out? Is it able to be walked? Can it be cared for properly? Is it a hot environment? Do they have to go up, 6 flights of stairs? All of those kinds of things.
True.
Yeah.
I mean, I think one comment I'm sure the viewers would have picked up, like myself, yes, is that all pet owners all over the world, they do care for their pets and to treat them like they're part of the family.
Absolutely.
But would you say that in Hong Kong, because of the sort of the crowdedness of Hong Kong, is it how we see it sort of be more visible about it, or you think you see that also in Australia and England?
I think pet ownership in Hong Kong is still a lot lower than it is in some other parts of the world. Really? So, currently it's estimated about 10% of households in Hong Kong own a pet dog or a cat. Right. There's about 500,000 pet dogs and cats in Hong Kong. If you look, for example, in Australia, 2/3 of households have a pet. Oh, so the actual rate of pet ownership is lower than some other countries.
Right, and also in Hong Kong, many of our friends actually call them, ask them to call them their daughters, or their sons are calling them daddy and mummy. Yeah. Do you see that in Australia as well?
Yeah, look, I think, like I said, a lot of people will consider pets to be part of their household. Younger couples, they're waiting for longer to have children. They're having children older, but they want to have something in their household to love. But I think also, we need to look at the benefits of pet ownership as well, and there are many. It's been shown actually that it improves mental health, physical health, social well-being. So actually cardiovascular risk is decreased in pet owners. There's been surveys that show you're less likely to have a heart attack. You have lower blood pressure.
Maybe as compared to kids, I'm sure.
Yeah, lower blood pressure, lower cholesterol, lower triglyceride, decreased stress hormones, decreased loneliness, decreased anxiety. All of these things are associated with pet ownership, and they're very positive, especially when you also consider, some isolated elderly members of the community. Having a pet can really enrich your life.
Yeah, I'm sure. Yeah. Right, Professor, let's go for a short break now. We'll be back with more Straight Talk. Welcome back to Straight Talk. We are talking to Professor Vanessa Barrs, the Dean of Veterinary Medicine and Life Sciences at CityU University, about pets in Hong Kong and the standard of veterinary care in our city. So, Vanessa, I think the very clear message is all pet owners love their pets, and it's great because it brings a lot of benefits. And in Hong Kong, we're doing just fine. Absolutely. Great to know. We are doing fine. All right, let's move on to something sort of more medically orientated. As we said, in Hong Kong we have small places. We still have 500,000 pets, and we have to be very careful that all these diseases won't be developed through them. So I just want to ask you, what type of medical conditions in Hong Kong that are most common that our pets will have, such that like emergency treatment or even cancer management? How does the standard of care in Hong Kong as compared to those in Australia or the UK? It's very similar. So I would say that the standard of veterinary health care is very similar. And the reason that it's similar is because in order to become registered as a veterinarian in Hong Kong, you have to have a degree that is accredited by the Royal College of Veterinary Surgeons in the UK or the Australasian Veterinary Boards Council. So that accreditation of veterinarians really determines that basic level of veterinary medicine and healthcare that's practiced throughout the city. Yeah. So when you talk about the current, if I want to talk about the current ecosystem of the sort of veterinary healthcare in Hong Kong, I mean, we said we have 500,000 pets. Yes. Not to mention other animals. Yes, many exotic pets. Exactly. I mean, how many sort of vets sort of in Hong Kong that we have? Yeah, so we have 1,500 registered veterinarians in Hong Kong, but probably only about 1,000 of those are practicing, and there are about 205
small animal veterinary clinics in Hong Kong currently.
Right.
Yeah.
So would you say that it's a very healthy environment, or you think we are sort of underdeveloped?
No, it's a healthy environment. It is a healthy environment. We have a number of specialist clinics and also primary care clinics around the city.
Mm-hmm. And one thing I'm sure the viewer is going to say to me, Eugene, you must ask Professor, because a lot of people are saying that when they bring their pets to see the vets, sometimes the fees can be quite expensive, even more expensive than a dental bill or even medical bill.
Yes, that is.
Is that is that true, or is it just a sort of saying in the public?
Well, it's certainly not more expensive than human healthcare, but if you think about it, the way that we have evolved with our pets, most pet owners want a similar level of care for their pets as they do for their children. And unfortunately, having a veterinary clinic to provide those services, it needs to function like a full-service human hospital for animals. And there are a lot of, that's very expensive without the benefit of government subsidy. There's no Medicare for pets, there's no Medicaid, and also the uptake of pet insurance is low. If you look at the type of equipment that you need to have in a veterinary hospital to provide those services, you need a digital X-ray. A lot of clinics now have got CTs. Some of the specialty clinics have got MRI machines. All clinics will have their own in-house laboratory services. They'll have an intensive care ward, a hospital ward. So those, these things are very expensive to buy, to maintain. Labour costs are also expensive. You have a team of professionals. Veterinarians take 6 years to go through university. If you go to a specialty clinic and you see a specialist, they've been in training for over 10 years.
True.
So that's
very
why
similar
some of these
to
costs.
the classical medical and dental training.
That's right.
Isn't it?
It's very similar.
And also one comment you make earlier is because the pets won't be able to express themselves.
Yes.
Very often you only see things happen at a later stage of the disease.
Correct.
And naturally that's going to cost more.
Yes.
Right. Actually, I'm just asking some question from the Consumer Council. They were saying that there were some complaints about veterinary fee transparency, and saying that sometimes they could be charged for procedures that they're unaware. As we've spoken earlier, this might be some sort of communication issue. As the Dean, how will you sort of making sure your students, when they graduate, will be able to sort of not fall into that little trap, so that there'll be a more harmonious relationship between the community and the veterinary circle?
Yep, that's a great question. And as Dean, I'm also a member of the Hong Kong Veterinary Surgeons Board. But for our students, we teach them, first of all, about communication and being professional. It runs from when they first start veterinary school all the way through. They have professional skills and practice courses where they really learn about integrity. And in fact, veterinarians are often regarded as trusted professionals in society because they're still seen as professionals that have that integrity. But we also teach them about legislation, duty of care, and codes of conduct, codes of practice. They must be very familiar with the Veterinary Surgeons Act, and they're examined on that before they graduate. So they're very familiar. There's two things that they need to be familiar with. One is the legislative environment, the legislative requirements that they must observe. But secondly, and just as important, is communicating with clients, not assuming that you know what your client wants. We can't judge people. And we also have really embraced something called contextualised care or spectrum of care. And what that means is not necessarily making clients think, or pet owners think, that they must have the gold standard treatment, that they're not doing the right thing if they can't afford an MRI scan. There is a level of care that can be provided for every patient, and it's our job as veterinarians to make sure that we work with the client, to work within the to help them make the decision that is best for the healthcare in that situation.
With the advance of AI and all the technology, would there be anything applied to sort of daily management of of such cases?
Absolutely. AI is already very embedded in veterinary medicine. So, for example, nowadays many veterinarians, when they do a consultation and they take a history from the client, in the old days they would make notes, make medical records. Nowadays it's all AI.
Right.
So AI can take that history, it can give you a list of differential diagnoses. It can help veterinarians, it can save them an hour in a day.
And have more time on the patient.
Yes.
Yeah, and also one more thing I've read up as well is
Yeah.
in the last year in Legislative Council,
Yes.
they're saying there's a rising trend in pet abandonment,
Yes.
meaning they're sort of not keeping pets anymore.
Yes.
And they thought to be at least partly due to the high cost of sort of the as we just said, the vet costs in terms of Medicare. Is there anything can be done about that?
Yes, I think that we need to educate the community and educate pet owners about the responsibility of having a pet. A pet is for life. Also, consider to adopt, not shop. You can spend thousands and thousands of dollars on a purebred animal when you can adopt a perfectly healthy cat or a dog from the SPCA and save that money for the healthcare for that patient.
Right, yes.
Invest in health insurance for animals.
Right.
That also means that when something unexpected happens, you can be prepared for it.
Right, just now you mentioned about reacting with the community. It sort of reminding me of your outreach program.
Yes.
So how do you sort of outreach to the people?
Yes, okay. So at the Jockey Club College of Veterinary Medicine and Life Sciences, we have a fully serviced specialty and general practice hospital, the City University Veterinary Medical Centre in Sham Shui Po, that provides up to very high-end services. But within the vet school, we also have a veterinary community outreach program, which is purely there to provide services for marginalised and underserved communities in Hong Kong, for the elderly, for people in remote and rural villages, for vision impaired, for people with mental health challenges. We have a team that works with our students to deliver subsidised desexing programs for those animals, as well as vaccination, worming, parasite control, preventive health care.
Right, Professor, last question.
Yes.
Give me a very brief answer. We know that Hong Kong standard is very high, but then given with the GBA, the proximity, that we have a lot of people bring the sort of services across the border.
Yes.
Does that apply to the vet circle?
Actually, it is illegal to transport an animal across the border into the Chinese mainland.
Okay.
There is rabies in the Chinese mainland. Every time you smuggle your pet across the border, there is the risk of introducing rabies into Hong Kong.
Well, I'm afraid we have to leave it there, and thank you so much, Professor, for sharing your insights.
My pleasure.
Animal welfare matters, not because pets are trendy, but because they depend on us completely. As Professor Barrs said, a healthy planet needs a healthy environment, healthy people and healthy animals. Have a good evening and see you next week.